the children's hospital, which is massively over budget, it would appear. I mean, it should have cost half a billion. It's going to cost at least 1.5 billion. I mean, isn't it going to be, however wonderful it is, a monument to incompetence?
I think the financial situation has been discussed at length, and I've been on the record now that I've been very clear. I've been very critical of that for many years.
In opposition, you were very critical.
Yeah, in opposition, and I'm happy to restate the position. I don't believe that the financial management of it was done properly. I that has always been my position. What I would say is, given that we know that, and we have gone into that in great detail, what I would say is I was in the Children's Hospital recently. I had a long walk around it, and when it is open, the difference that it is going to make to children and to their families will be incalculable. We will have a national children's hospital and national children's services that will be the envy of the world. And putting aside the financial aspect, which I'm not diminishing, I'm accepting that that is the case. But what I've got to focus on is I've got to focus on delivering the hospital and getting the services open for children and their families.
Do you have concerns, and I'm sure the HSE has concerns, you want the very best of staff to be available, and of course there will be the transfer of staffs from the other hospitals, but you'll need more. You'll also need highly qualified nursing staff, and the question will be, given emigration and so on, and we're told a lot of the nursing graduates graduating just at the moment are going to skedaddle off because they can't afford to live close to the children's hospital.
One of the many benefits of the new hospital is going to be, it'll be a very attractive place for people to work. So Children's Health Ireland, which is the 3 hospitals at the moment, they're increasing their staff at the moment. They're reducing their waiting lists at the moment. They really are doing very good work. They've opened the 2 satellites now, the emergency medicine satellites, which actually I have availed of. I opened one of them and then immediately availed of it as a parent. I was back in with one of my own kids. One of the things that is going to make it easier to hire all of these people that you quite rightly say we need is they will be working in an absolutely world-class hospital.
But where will they live? There's no parking for them. So even if you're coming on shift at 6 in the morning and there's no public transport, what are they to do? Because if you're suggesting they live in the general area around the hospital, the rents there are going to go sky high because there'll be a huge demand. If they're living in the hinterland, they'll need to get there somehow, and they won't have parking for their cars.
Yeah, there's no doubt that there is a serious issue, a serious crisis, not just in terms, as you rightly say, Pat, of the cost of rental, the cost of buying a place, but also just the availability of it. The Housing for All plan is set to deliver, I think, about 25,000 homes. We need more. We need to be moving up to 35,000 a year. That is the government's plan. And ultimately, we have to make it affordable to live in and around the city centres for exactly the reasons that you've just given.
Do you anticipate, as the INMO want, that you'll have to pay a city allowance to make it affordable for people? In other words, if you're working in Tullamore, you don't get it. If you're working in Dublin or Galway, you do.
What I've asked various hospitals to do, and what I've asked the HSE to do, is particularly where there are bottlenecks in recruitment. So let's say some hospital just can't hire paediatric nurses or theatre staff or whatever it may be, to be creative. In some cases, is it transport? In other cases, should the hospitals be doing what they did in the past, which is actually have accommodation for some of their staff? For foreign workers.
So do you see things like I see every morning, 7 o'clock in the morning, I see the Microsoft bus, the executive bus, delivering people to that particular company. Is that what you might envisage, that there would be buses touring the hinterland, picking up nursing staff?
Well, I think I think what we've got to do is we've got to give the local hospitals and ultimately the 6 regions that we're moving to the freedom locally to solve their problems, because the solutions are different in Letterkenny to the National Children's Hospital. One thing I would say about the James's site, it's there now. There's no point revisiting whether it should have been or not, but it is there. It is well served by public transport, so that is one advantage of it.
Transport is running.
Yes, when the transport is running, sure, but it's a big site with good public transport links.